Hi, my name is David Amazon, and I'm a student physical therapy assistant from CBD College, and today we'll be going over a case. In this case, the patient is a 6-year-old who presents with spastic cerebral palsy and is classified into gross motor classification system level 3. Patient was born at 28 weeks and suffers from a left intraventricular hemorrhage, which she then received physical therapy for. She sat at 18 months of age and later had 2 surgical procedures for heel and core tendon transfers and adductor releases of the hips. Patient is brought into physical therapy by her father and attends a daycare after school or is with her grandparents. In regards to BMI, she is below normal values at 15, where 20 to 24 is considered normal values for her age. In motor functions, she is below normal in hip flexion, adduction, abduction, internal rotation, and external rotation. However, in passive range of motion, the patient's range is hypermobile in hip internal rotation. Tone is moderately increased in the hamstrings, adductors, and plantar flexors bilaterally. In regards to muscle performance, upper extremities is within functional limits, while the lower extremities are considered to be less than fair in regards to the presence of tone. Patient requires an assistive device to ambulate over regular surfaces and assistance in ascending and descending stairs with a rail. Patient can walk for 20 feet and is able to dress herself for school within 15 minutes. Some contextual factors in this are things like personal factors, where the patient's age is 6 years old at the start of the case, but towards the bottom of the case it mentions that she is now 12 years old. She seems to be motivated in daily life as she continuously is able to dress herself for school and is now heading into the first grade. Her activity levels are limited due to her condition, but she is able to walk 20 feet with an assisted device. Some environmental factors can be is that she attends school regularly, and afterwards she attends a daycare or is taken care of by her grandparents. Both of her parents work, however her father is the one who brings her to therapy sessions. A psychosocial factor can be her father, which is the one who brings her to therapy sessions, and she is able to complete her dressing before school independently, more and more at home. There is also a calendar in place at home to help remind her to complete her home exercise programs 4 times a week. In regards to socioeconomical factors, transportation is done by the father, who seems to be the only one to bring her in, possibly indicating that her mother may not be able to attend due to scheduling conflicts. Personal biases. In this specific case, oftentimes when we see a father bring a child into appointment, people can often see it as he's a single father whose mother's not in the picture, but that's not the case. Here, the father's schedule just seems to align more with the appointments, and he is able to bring his daughter in as needed, while the mother is able to work. In order to limit this personal bias, we can understand the situations in which the patients are placed in and how it does not align with our biases. In doing so, we can understand other experiences and within time rid ourselves of the biases. An appropriate strategy we can use to enhance patient outcomes is active listening, where we can listen to understand and not listen to hear, and understand any hardships or obstacles the patient or family is feeling and work towards getting past those obstacles. A recommendation that can be made in order to increase safety and accessibility at home is clearing the floor of any objects, making it easier for the patient to maneuver through a comfortable environment with the use of an assistive device, or maybe even without, when she is completing her home exercise programs. In doing so, it can increase the confidence and further reach our goals. There are some resources to help this specific case, such as the United Cerebral Palsy, which offers social clubs, camps, and even workshops to help individuals in the same situation, and it can help to promote independence and social interactions while maintaining safety and comfortability. Thank you.